you.
Knock.
Hi, come in.
Hello.
Hi.
How are you?
I'm good. How are you?
I'm good.
Good.
My name is Valerie Wright. I'm a nurse practitioner.
Okay.
Are you familiar with the nurse practitioner role?
I am. You're an advanced practice nurse.
Yes.
Okay.
So we're able I can provide care for you. I can diagnose. I can write prescriptions. Do you have any questions about that?
Nope.
Okay. And can you tell me your full name?
Jessica Prito.
Okay. And your birthday?
22689.
Okay, great. I'm just observing you, like you're all over your mood, your facial expressions,
Okay.
how you're engaging with me. And so I'm just asking you questions about your orientation. Can you tell me why you're here today?
I just need a wellness checkup.
Okay, okay. Can you tell me what month we're in?
It is December.
And the date?
December. Is it December 4th?
Yes.
Okay.
And then what holiday is coming up next?
Christmas.
Awesome.
Yeah.
Okay. So do you have any symptoms or any pain or any sort of problems you want to talk about first?
Oh, not really.
Okay, I'm gonna wash my hands.
Okay.
All right. And I'm gonna start by, I'm gonna just do a series of blood pressures.
Okay.
Okay. So, you've had blood pressures taken before?
Yes.
All right. So I'm just going to put the cup on. I'm gonna pick the appropriate cup that's a good size for you. All right. We don't want it to be too big or too small. Okay. And I'm gonna listen to your pulse first.
Okay.
Your brachial pulse. All right. And now I'm gonna pump up the cup, okay?
Okay.
I'm just gonna go 20 more. Are you doing okay?
Yep.
Okay, I'm gonna let the air out slowly. Nice. About 125 over 75.
Okay.
Okay. I'm gonna do your left arm here.
All right.
Same. Same. Go over here. And 20 over 70. We just want to make sure they're pretty similar in both arms. And then I'm going to have you stand.
Okay.
And I am going to just go back to your right arm. We just want to measure it in a different position. And then you can just stand on this arm at your side. Perfect. Listen here. Oh, 118 over 60.
Okay.
All right, great. Have you ever been told you had issues with this before?
No.
Okay. And then I'm just gonna feel your pulse, and I'm just gonna feel for like how regular your pulse is.
Okay.
I'm gonna time it for 30 seconds. All right. Okay, perfect. Nice and regular. Has a good impulse. All right, 82.
Okay.
Okay, great. And then I'm just gonna watch your respirations, and I'm just observing you. You're nice and well groomed.
Okay.
Posture is great. So for 30 seconds, we're going to do the same thing. Hold on. Like that. You ready?
Mhm.
Okay. Okay. That's 30 seconds. That's 18.
Okay.
All right. And you don't look like you're in any distress with your breathing. Have you had any problems with your breathing?
No.
Okay. All right. And the next thing I'm going to do, I'm going to go head to toe.
Sure.
Okay. Do you have any questions?
Not really.
No. So I'm going to take your, or if you don't mind taking your hair down. Okay. I'm going to section off in like 3 sections. Any itchiness or dryness?
No.
No. No sores, lesions?
Nope.
No. Okay. This side. I don't see any like breakdown in your skin. I don't see any dryness. I'm just gonna feel. I'm just feeling for any bumps, any asymmetrical, asymmetry in your scalp. Go up underneath here. Any pain when I'm touching you?
Nope.
So the next thing, I'm gonna just feel your sinuses. So you've got your frontal sinuses. I just want you to tell me if there's any pain. So you let me know, okay? Pain with that?
No.
No. You go underneath. These are your maxillary. Any pain when I'm pushing?
No.
And then your ethmoid, which are a little tricky. They're up here in the corner of your eye. So any pain with that?
Mm-mm.
I'm just looking at your face. I don't see, your skin looks perfect.
Okay.
I don't see any abnormalities, any breakdown. Have you had any problem with your skin?
No.
No? Okay, great. So next I'm just gonna feel, it's called your TMJ. It's your joint here when you open your mouth and you chew. And it's right here in front of the tragus. Okay. Any pain when I'm touching there?
No.
Can you open your mouth real big? Any pain with that?
No.
Do you ever hear any clicking when you chew?
No.
No. Can you move your jaw here from side to side? I'm kind of pushing a little bit of resistance. And then can you put your jaw out forward here? All right, nice. I want you to just feel your temporal muscle. Sorry, just open your mouth, clench your teeth. Then your masseter muscle. Good, this is your cranial nerve 5. I'm just making sure that's intact. Okay, perfect. The next thing is your cranial nerve 7. So I'm just gonna have you smile real big for me. Great, frown. Doing it with you. Raise your eyebrows. Puff out your cheeks. And then I'm going to just remove your glasses for just one moment.
Okay.
And I'm gonna have you close your eyes, and I don't want you to let me pry them open. I'm not gonna hurt you. Perfect.
Okay.
Well, maybe we'll leave the glasses off. Can you, when we do the vision, I'll have you put your glasses on.
Sure.
I just want to look at your eyes. I'm just looking for any redness, any drainage. Are your eyes burning or itching?
No.
No. Okay, great. Oh, you're fine. I'm gonna have you put your glasses back on, okay? And then I am going to have you cover one eye. I'm gonna have you hold this out. Just extend your arm.
Okay.
And can you read whatever you can read in the smallest print?
LTFPH.
Great. And now can you cover the other eye?
LTFPH.
Great. And now with both eyes?
LTFPH.
Great.
Okay.
And that's part of one of your cranial nerves is the second one. Okay. So the next thing is going to be, I just want you to look straight at me.
Okay.
Okay. And I want you, I'm gonna wiggle my fingers and bring them in towards you. Just tell me when you see my fingers, okay?
Okay.
Okay, so,
Yes.
okay.
Yes. Yes. Yes.
Okay. And I recover one eye. And I want you to tell me how many fingers I have held up, okay?
Okay. 1, 2, 1, 2.
Okay, great. I'm gonna have you do your great.
1, 2, 2, 1.
Okay. And then I'm just gonna have you cover one eye. And I'm just looking at your other eye to see if you're looking straight at me. I just wanna make sure the eye's not deviating.
Okay.
And uncover. Now do it with the other eye. Okay. Good.
Okay.
Good. And then I'm gonna do the your extra eye movements. So I just want you to follow my finger.
All right.
Okay. So good.
Okay.
Good. Just making sure your eyes are able to follow. Now I just want you to look at my finger.
Mhm.
And I'm gonna bring it towards your nose, and I want you to keep your eye on my finger, okay? Great, and that's accommodation.
Okay.
Okay. I'm gonna have you take off your glasses because I'm gonna look into your eye. I'm just gonna grab my otoscope here, turn it on. There we go. Make sure it's at 0. Okay. I'm just gonna I'm gonna check your pupil reaction. Okay, this is cranial nerve 3, 4, and 6. So nice. Perfect. Meaning that your pupils are responding to light,
Okay.
and that's a good thing. And then next I'm going to look into your eye. So it's right eye. Okay. I'm gonna hold it here. Have you just look kind of over my shoulder. I'm looking for the red reflex, which I see. I'm gonna come in. And I'm looking for the structures of your fovea. So the physiologic cup, the margins are well defined. I see your vessels, your arteries and veins. I don't see any papillary edema. Okay, good. I'll go back to 0. Now look in your other eye. Okay. Just gonna hold you kind of firmly here. Looking for that red. I'm looking for the same structures. Again, I see the structures, the physiologic cup, the vessels, there's no edema, the optic disc, nice and clear.
Okay.
And then we're gonna move to your ears. Any issues with your hearing?
Nope. Nothing.
Nothing.
You're fine.
You hear fine. Okay. Right. The first thing I'm gonna do is I'm just gonna do a whisper test. I'm just gonna occlude one ear,
Okay.
and I'm just gonna have to repeat 2 words for me. Okay. Occlude 1.
Apple. Baseball.
Great.
Bat.
Cat.
Cat.
Nice.
Okay.
Okay. And the next 2 tests are, this is a tuning fork, and you're gonna feel some vibration.
Okay.
I'm gonna just place it in the middle of your forehead,
Okay.
and I just want you to tell me if you hear it in both ears, okay?
All right.
Okay. This is the Weber test. Are you hearing it
Yeah.
equal?
Mhm.
Okay. We're just looking to see if it louder, if you can only hear it in one ear, but you hear it in both.
I hear them both.
Okay, great. And then next I'm gonna put the tuning fork behind your ear,
Okay.
and then I'm gonna put it in front of your ear. I want you to, when I put it behind your ear, just tell me when you stop hearing the vibration, okay?
Mhm.
All right.
I can't hear it.
What now?
I can hear it.
Tell me when it stops.
It stopped.
Okay, great. I'm gonna do your other ear, okay?
It stopped.
And how about now?
I can still hear it. And it stopped.
Okay, good. Where I'm just evaluating your optic nerve, your auditory nerve, and then I'm just gonna look at your ears here, and I'll make sure your outer ear, there's no drainage. Does that hurt at all when I'm pressing the ear in or pulling?
Nope.
Okay. Let's see here. Any pain with that?
Mm-mm.
Okay, now I'm gonna look inside your ear.
Okay.
All right. I'm just gonna be looking at the structures of your ears and your ear canals and making sure that there's no blockages, that your eardrum looks intact and nice pearly gray, okay?
Okay.
So I'm gonna pull up and look right inside this ear here. Oh, the eardrum is, I see the cone of light. Okay. The eardrum is nice pearly gray, no bulging. And I see the handle of the malleus. Okay. I'm gonna move over here to Thank you. Up here, actually. Nice. The ear canal is nice and clear. A nice cone of light, nice pearly gray. Tympanic membrane. And I'm able to see the structures. The handle of the malleus.
Okay.
And there's no pain in your ears, correct? No. Okay. I'm just gonna have you face me.
Okay.
The next thing we're gonna do, I'm just gonna have you include one side of your one nostril.
Okay.
Just breathe out for me. Great. Now can you do it to the other side? And I'm gonna change the head of this, just so we have a clean.
Okay.
Okay. And I'm gonna look up inside your nose. I'm gonna make sure that there's no lesions, no hemorrhaging in the back. I'm gonna look at your nasal septum, make sure it's intact.
Okay.
Okay. Good. Okay, good. Okay, I'm gonna do your other side here.
Okay.
Is there any pain when I'm doing that?
Mm-mm.
Okay, good. I don't see any abnormalities in your nose.
Okay.
And you're able to smell okay?
Yeah.
Okay. I'm gonna put on some gloves and we're gonna look in your mouth.
Okay.
Okay. And I do need to I'm gonna have you say ah. I just wanna look for the equal rise of your palate and your the uvula
Okay.
and the different structures in your mouth. Any problems swallowing?
No.
Can you look up and just swallow for me? Nice, okay. Any problems with your tonsils? Any tenderness?
No, I get frequent tonsillitis, but
Okay. I'm still looking at your lips. Some are nice and hydrated, no cracking, no drying.
okay.
And then I'm gonna have you just open your mouth. I'm gonna look all the way back in your mouth here. Look at your teeth and your gums. Nice. Any pain with brushing? No. I'm just gonna feel your teeth. No loose teeth. Okay, great. Now if you stick your tongue out, just stick your tongue out for me. All the way out. Making sure that's nice and straight. It's not protruding
Okay.
to the to one side or the other. That's your cranial nerve 12. And I'm just gonna lift your tongue up now. I'm gonna look underneath, to the sides. I know it's a little uncomfortable. Okay, great. Now I'm gonna take a look at in the back of your throat.
Okay.
All right, I'm just gonna have you, when I press down, I'm gonna look and have you say ah. Okay, I'm gonna look at your tonsils. Okay, ready? Say ah. Your tonsils are a +1,
Okay.
which is an average
Okay.
size for your tonsils. Your uvula raised, your pillars raised, all equal.
Okay.
That's great. Okay. I'm gonna take these off. I'm gonna wash my hands.
Okay.
And I'm gonna look at your neck. Okay. All right. I'm just gonna observe. I'm also looking at your trapezius muscle, making sure that's nice and even. Okay. I'm just gonna feel your trachea, which is nice and midline. I'm gonna have you raise up and I'm gonna push down. Great. All right. That's cranial nerve 11. All right. I'm gonna have you turn against my hand. Good. Good. Now I want you to put your chin down, all the way to the ceiling, and then side to side, and then your ear to your shoulder. Any pain when you're doing that?
No.
No pain. And then I'm gonna feel your lymph nodes, okay? So these are your preauricle. I'm gonna go in a circular motion. No pain.
No.
Post-auricle. I'm gonna go back to your occipital.
Okay.
Your posterior cervical. I'm gonna travel down your anterior cervical. I'm gonna come up here. Your submental. And then I'm gonna continue down. And I'm gonna go, these are called your supraclavicular.
Okay.
All right. And I don't feel any hardness, any swelling,
Okay.
any enlargement. All right, I'm gonna examine your thyroid.
Okay.
So I'm gonna come behind you and ask you to do a couple things. I already had you swallow.
Mhm.
You're good with swallow. Okay. There you go. I'm gonna have you put your chin down, and then can you look down to your right side? Perfect. And swallow. Good job. And now I'll have you do the other side and swallow. Okay, great. All right, good. If I felt any enlargement or any sort of lumps or masses, or if you're saying it was tender, I would listen for a bruit
Okay.
in your thyroid. Okay. And now I'm gonna come to the back of you.
Okay.
And I'm just gonna observe. Also, again, the symmetry here of your trapezius muscle. And I am just observing, this is your posterior thorax. And I don't see that you're in any distress at all. Okay. Yep. And I'm just gonna palpate with any pain when I'm palpating.
No.
Okay. Now I'm gonna do the same thing. I just want you to say 99, okay?
Okay. 99.
Okay, good. Can you lean forward just a little? Yeah.
99.
I got it. Okay, good.
99. 99. 99.
Nice.
99. 99.
Good.
Okay.
Good. Yeah. I'm feeling for vibrations, okay?
Okay.
All right. And then I might have you swing your legs. I just need to cuss, so I might just swing you out here. So, okay. And I'm gonna do this in the ladder pattern. I'm just listening to your different your lungs, your different lung fields, okay? All right, and now to just percuss the difference of your diaphragm when you're breathing in and when you're breathing out.
Okay.
Okay, so all I want you to do is take a deep breath in. Okay, now let it out. And that is about 2 centimeters, which is a really good range. Okay.
Okay.
And now I'm gonna just tell me if there's any pain when I do this.
No.
Okay. And that's your costovertebral angle.
Okay.
Now I'm gonna listen to your carotids. Okay.
Okay.
Listen with the bell. And it's the lower 1/3 of the neck. I'm just listening for a bruit. Now with your mouth open, I'm gonna have you take some deep breaths for me. Okay?
Okay.
Okay, deep breath. Okay, deep breath. Now you're gonna just remain seating, and I'm going to do the anterior portion of your lungs.
Okay.
Okay, so I'm just gonna feel, let me know if there's any pain when I'm pressing.
Nope.
No.
No.
Okay, and we're gonna do the 99, this contactile frontis.
Okay. 99. 99. 99.
Okay.
99. 99. 99.
And now I'm just gonna percuss your chest.
Sure.
Just like the back.
Okay.
Now I'm gonna listen to the front.
Okay.
All right, same thing, just a nice deep breath. All right. All right. And now I'm just gonna continue to just feel the lymph nodes in your armpit area
Okay.
or axilla area, your chest wall, down your arms, okay? So I'm gonna just bring this arm out for me. And just leave it straight for now, okay? And I'm just gonna go in a circular motion. And just feeling for any lymph node enlargement. I'm gonna have you bend your arm up. There's some lymph nodes right back here, called your epitrochlear nodes. Any pain with any of that?
Nope.
Okay. I'm gonna do your other arm. Same thing, okay, just leave it out straight. I'm just gonna kind of feel in your whole axillary area, Yeah, I'm sorry. I tickle a little bit.
Tickling, yeah.
Yeah. Great. I see your range of motion with your arms is, you're very flexible. You have good range of motion.
Okay.
I'm gonna feel now your pulses in your arms, okay? So first in your brachial area, I'm just gonna make sure they're nice and equal. Like I said, a nice regular rhythm.
Okay.
And then these are your radial pulses. I'm also observing your skin on your arms, looking for any hyperpigmentation. And I'm just gonna feel for your temperature. And I'm gonna look at your hands. Nice. This is capillary refill. I just wanna make sure that pink color comes right back in, which it's less than 3 seconds, okay?
Okay.
Look at your palms. Like I said, just keep feeling. All right.
Okay.
And now I'm going to listen to your heart tones.
Okay.
All right.
Is this position okay? Am I sitting okay?
Yeah, I think so. Yeah.
Okay.
Good. Okay. First, I'm going to listen pulmonic with the diaphragm. Aortic. Pulmonic. Tricuspid. Mitral. Apical. I hear an S1, S2, which is a sinus rhythm.
Okay.
I'm not hearing any murmurs. Okay. Now I'm going to listen with the bell.
Okay.
Same areas. Aortic. Pulmonic. Tricuspid. Mitral. And then apical.
Okay.
All right. I'm gonna have you just lay down for me, and we're gonna finish the rest of the exam.
Okay. All right.
Oh, can you sit for me for a second? And I'm gonna I forgot to listen to you, just leaning over. Just lean forward for me, and I'm gonna listen to the base of your heart. And then exhale. Can you exhale again? Okay, good. Just trying to listen for any murmurs, any S3 or S4 sounds. Now I'll have you lay down.
Okay.
Pull this chair away. Okay, I'm gonna have you look over to your left. Okay, I'm just gonna approach you here. We're gonna look at your JVP, which is your jugular venous pulse. And I'm gonna measure that, okay? This is in centimeters. And it's 2 centimeters.
Okay.
Which is a good range. Yeah. Alright, now I'm gonna listen to your heart again while you're laying down. Okay?
Okay.
With the bell on the diaphragm, same areas. feel for your apical impulse. I'm just gonna go up under. You can just breathe normally.
Okay.
You're doing great. Okay, now I'm gonna have you just raise your arms up over your head. And we're just gonna examine the rest of the breast, okay? So I'm gonna do a clockwise circular motion.
Okay.
And then I just want you to tell me if there's any pain. I'm just feeling for any sort of enlarged lymph nodes, any lumps or bumps, okay? Is there any pain?
No.
Just with the flat of my hand here,
Okay.
okay? And then to pinch the nipple just to make sure there's no discharge.
Okay.
And I'm gonna move over to your left breast. Okay. Now I'm gonna have you roll to your left, and I'm gonna listen with the bell. And this is just to the apical area and the mitral area. I'm just listening for any murmurs, gallops, rubs, any abnormal heart sounds, which I don't hear. Okay, good.
All right.
Now I'm just gonna look at I'm just gonna look at eye level to your chest and your belly. I'm just making sure everything is symmetrical. I don't see any heaves or thrills in your chest area. And I'm just looking for any sort of peristaltic movements in your belly. I'm making sure everything looks symmetrical. Okay. I'm gonna listen to your belly, and then I'm gonna listen to your aortic, your abdominal aorta there, and then I'm gonna look for or listen to your renal, iliac, and femoral arteries.
Okay.
Okay. And I'm gonna listen for bowel sounds. I want to hear some nice gurgles,
Okay.
which I hear. Your belly's active. Now with the bell, I'm gonna listen to those, to your aorta. Your renal. Your iliac. And then your femoral.
It's going to take multiple weeks of distribution to even get our healthcare workers their first of the 2 doses that they require, while also getting to the long-term care facility residents. But remember,
I'm gonna percuss your abdomen.
Okay.
Okay. And I'm gonna do that in 9 different areas of your abdomen. And then I'm just gonna lightly palpate your abdomen. Okay. Just want you to tell me if there's any pain with that. No? Okay. Now I'm gonna do a little deeper palpation. Any pain?
No.
Any pain?
No.
Okay, good. And now I'm going to actually pull this up. I just need to palpate your liver, which is up on this right side, kind of underneath your rib cage. So what I want you to do, I want you to take a big, like inhale.
Okay.
Okay, deep breath. Go ahead. I slide my fingers down to through the liver.
Okay.
Okay. Actually, it's through the end. Okay, again, nice deep breath. And then the spleen. Now, normally we shouldn't feel the spleen, okay? Same thing, a little bit more under this rib cage here. Deep breath. And I'm gonna kind of lift up and I want to feel this kidney, okay? Any pain with any of that?
No.
Now I'm just gonna feel these are inguinal lymph nodes. So we just wanna make sure there's nothing swollen, okay? And I'm gonna feel your femoral pulses. They're nice and equal. They're a nice rhythm and beat. Your popliteal. You're behind the knees. Your posterior tib. And then your pedal.
Okay.
Hopefully you can see me.
Mm-hmm.
Yeah. Got nice pulses.
Good.
Down your toes. We're gonna look for capillary refill. It should be great because you had nice pulses. I don't see any breakdown, any sores. I'm just gonna feel your legs. Your feet are a little cold, but it's cold in here.
Yeah, that's normal for me.
And then I'm just gonna check for edema in your ankles. Okay, and I'm gonna push kind of hard. I just wanna make sure it doesn't leave like an indentation. Which you don't have any edema.
Good.
Have you ever noticed any leg swelling?
Not since I was pregnant.
Oh, yeah. Okay, can I help you out?
Sure.
Okay, good. And then as you're sitting there, or actually you can have a seat over here.
Okay.
I do need to just look at your breast in a couple different positions, okay? So I want you to put your hands just to your side, okay? And I'm just making sure everything, okay, and then put them on your hips. Nice. And then up over your head. Yeah. Okay, good.
Okay.
All right, and then I'm gonna be checking your strength.
Okay.
Okay, so we'll start with your upper extremities.
Sure.
So I want you to just put your arms like this, and I'm gonna push against you, and just don't let me. Okay, so
Okay.
resist me. Perfect. And now I'm gonna pull, and I want you to. There you go. Good. Good. And I want you to squeeze. Just squeeze my fingers equally. Okay, good. And then I'm gonna do the same thing with your legs. So I'm gonna push down. I want you to push up on my hands. Perfect. And then I'm going to adduction. So I'm gonna try to pull your legs apart. Just pull in. Nice.
Okay.
And then push your legs out. Good. That's good. And then I'm gonna also, while I'm down here, I'm gonna check your dermatomes.
Okay.
So let's see. I just want you to tell me if you have any sort of, if you can feel what I'm doing, okay? Gonna go in a circular motion.
Yes, I can feel that.
Okay, good.
Yep. Yep. Yep.
Okay, and then your wrist. So I'm gonna go here. Can you feel that?
Yes. Yes. Yep. Yes.
Okay, good. Okay, and then the other, it's called proprioception. It's just that you can tell me, I'm gonna just move your extremities, your toes, and your fingers up and down a
Okay.
couple times, and then I'm just gonna ask you which position that they're in, okay? So I'm gonna start with this foot. Hopefully they can see me. Okay. Yep, close your eyes. Okay.
Up. Down.
Okay, good.
Up. Down.
Good. And now we'll do the same toes here.
Down. Down. Down.
Okay, now we're gonna do your fingers,
Okay.
okay?
Up. Up.
Good.
Down. Down. Up. Down. Down. Down.
Okay. Next thing we're gonna do is vibration. Okay. And it's gonna go on the pad, the fleshy part of your fingers. You're gonna do your fingers and your toes.
Okay.
Okay. So I just want you to tell me if you can feel the vibration. Okay.
Yes.
I'm gonna turn your hand over.
Can feel it.
Okay. Tell me when it stops.
It stopped.
Okay. Good.
Can feel it. And it stopped.
Good. We're gonna move on over to your left hand.
Feel it. Stopped. I can feel that. And it stopped.
Okay. Move to your toes. Bring this up. I'm sorry. Good.
I can feel that.
Okay.
And it stopped. I can feel that. And it stopped. Can feel it. It stopped.
Good.
I can feel that. And it stopped.
Good.
Okay.
Okay, good. And then what I'm gonna do, I'm just gonna have you stand up for me.
Okay.
All right. So you have a nice, able to get up on your own without pushing up. I'm just gonna have you walk normally, normal gait. Then you can turn around and come back towards me. Okay, good. Can you walk, turn around, and then do the same thing on your tiptoes? Perfect. And then on your heels. It's a little awkward.
Yeah.
And then I'll heel to toe. So this is hard for me. And there you go. Good.
Okay.
Yeah, and then back. Okay. And then I'm gonna have you just turn towards me. I'm gonna have you close your eyes
Okay.
and put your arms just straight to your side and your feet together.
Okay.
And I'm just assessing like your balance, your positioning. Great, that's called the Romberg test. Okay. Now I'm gonna do turn around.
Okay.
And I'm gonna have you bend straight over with your legs straight. I'm just looking at your spine. I'm looking for any curvatures, kyphosis, lordosis. So if you're kind of bulged out or you're sunken in, and everything looks good.
All right.
Okay. And the one thing I forgot was just testing the sensation of your face. So I'm gonna have you close your eyes, and I just want you to tell me if you can, what you're feeling. Okay.
I can feel that.
Okay, good.
I can feel that. I can feel that. I can feel that. I can feel that.
Okay, good.
I feel that.
Okay, and then I'm gonna have you, it's kind of awkward, but, because you're in a chair, but I'm gonna have you put your legs out, and I'm gonna
Okay.
have you go from your heel up and run it up your shin.
Down. Like
Yep,
this?
down and, yep,
Okay.
and then, perfect, and then the last thing, I'm gonna check your reflexes. So we're gonna do your biceps.
Okay.
So I just want you to relax your arm, and I'm gonna feel the tendon, okay? Okay, and I'm just looking for a little twitch in your wrist. Done. There,
Okay.
perfect. That's good.
Mhm.
Okay, and now we're gonna do your tricep. So I really just want you to, hang your arm and just put all your weight on my hands here. Okay, just really dead weight. Perfect. There, good. Now on your left, just let it dead weight there. I know it's hard. Okay, good. And then I'm gonna do your knees.
Okay.
And you're a little bit, I'll just put all your dead weight on my arm. Perfect. And I'm just looking for your reflex here. Did it go?
I think so.
Yeah,
Yeah.
I thought I saw. Okay, good. Just dead weight again. Perfect. Tall. Ready? Good.
Yeah.
Okay, and now we're gonna do your Achilles. So I'll just have you perfect. Now, we're just looking for that little twitch. Yep. Sorry. And then this on the left side. Good. And now I'm gonna just have you hold your feet out. And I'm just gonna do, it's called the Babinski. And your toes should come forward, not spread apart. Okay? So it might be a little uncomfortable. Sorry. It tickles. Okay. And there it goes. Alright. And that completes our exam. Do you have any questions
Okay.
for me?
No.
And like I said, I've been observing your skin. It all looks, I don't see any abnormalities, anything that's concerning.
Okay.
And then your range of motion, of course, you're able to bend over, raise your arms up, put your legs out. Okay.
Sounds good.
All right. Well, thank you very much.
Okay. Thank you.
Thank you.
Thanks.